my name is Gary. I'm a respiratory care practitioner here in Los Angeles, California, and this video is going to be talking about day shift versus night shift. So for those of you guys who don't follow me on Instagram, which you should because I post so much more on there, on stories, on normal posts, everything, IGTVs, all of that is on my Instagram, where I have all these different advice, different quizzes, different behind the scenes of me working and my hospitals and stuff like that. So for those of you who don't know, I work at 2 acute care hospitals here in Los Angeles. I got super lucky to get hired at 2 facilities, especially before the holidays. And you guys, I cannot stress enough how amazing it is to finally get paid for what you're doing. You know, you work for months and months for free as a student, and to finally get paid has been amazing. But yeah, so because I work at 2 different facilities, I have been having orientation like crazy. I finished orientation at my first facility weeks ago, and I just finished orientation at my second facility. It was a 6-week orientation, but we were so short-staffed. Almost every single day I was getting pulled off of my orientation to have my own full workload. But you know, that's the way you learn and that's the way you do things, is kind of just being thrown out there. I definitely had orientation and training, and people taught me how to do this or that, but there were still a lot of things that I wasn't sure of, or that you know, I wasn't necessarily properly trained on. And that's why you have your leads and your coworkers, and you know, everybody's there to help you. Everybody is always asking if you have questions or if you need some help. So don't ever feel like you are going to be thrown to the wolves and be by yourself and not have help, because they really want you to succeed. They are your coworkers. You do work there. You're not just a student. Like, I can't stress enough how nice everybody is in trying to make sure that you're succeeding. But yeah, so what I want to talk about was day versus night shift. Because of my orientation, sometimes I would have to be on days, and then at my other facility, and what I got hired as at my second facility is night shift. So I did get to work both many times, and let me tell you, they are so different. Day shift is so busy. Like, night shift can be busy. Like, I'm not gonna lie, night shift can be hectic, but day shift is not only hectic, but like the hospital is hectic. There's so many people in the hospital. There's visitors and family, and there's, you know, people coming into the hospital, there's people going out of the hospital. There's like the x-ray techs, the phlebotomists, the physicians, the physician assistants, there's students, there's the instructors for students, there's nursing students, there's like so many people in the daytime. You can't even, like, I can't even give a breathing treatment sometimes because there's so many people in the room, or because this patient is like talking to the social worker, or they are doing physical therapy, or, you know, I can't stress enough how busy day shift is. I personally don't like it. During days, you know, RTs are doing weaning and extubations and SPT trials and oxygen walking trials and all this stuff, which is really awesome. You get to experience so many other things on day shift. You get to keep your skills very sharp. You get to just really feel like you're doing your all as an RT. Whereas night shift, we are not intubating unless it's an emergency. We're not extubating unless it's an emergency. You know, there's a lot of things that we don't do at night because it's night time, you know, and we just don't do that at nighttime. Like, we don't do weaning at nighttime. You know, you want your patient to rest at night so they can do a weaning trial during the day. And so sometimes at nighttime you might feel like you're kind of losing your skills a little bit. But I wouldn't mind doing day shift every now and then, but to do it all the time, I just could not do it. It's so exhausting. The best part about day shift is being able to, like I said, use your skills, but to personally, to like be able to go home and like have time with your family, and to have a normal schedule, and to, you know, have dinner with your loved ones, and to do things. You know, whereas night shift, you're kind of working 2 days. Like, if I'm working Saturday night, I get off Sunday morning. So I'm working Saturday and I'm working Sunday. And so that's kind of the bad part, you know, like if I work Saturday, I have Sunday off, but I work Monday, it's like you're working Saturday, but you get off Sunday morning. So Sunday's not really a day off because you have to go to work like the next day. And it's like you just worked that day and then you're working the next day. So it's like, where was the day off? So in that type of aspect, night shift kind of sucks, but night shift is it's more chill. There can be a lot of downtime. I feel like in day shift, like there's hardly any time to sit down, where I'm not gonna lie, at nighttime, like you might have 2 hours of downtime, which is amazing in the sense of that, like, oh, you can catch up on your charting or you can restock supplies. Whereas day shift, I feel like I'm scrambling to finish my charting at the end of the day. And I don't know, I just don't like that. And as a new grad, I feel like day shift is just harder. There's so many things you're not used to. There's so many things you're still trying to get used to by being on your own, by being a new grad, by being a new RT. And it's just difficult, or more difficult, I would say. If I had day shift, I think I might be more stressed, but I don't know. I just really like night shift. I'm a night person. I've always been a night person. I typically stay up late on my days off, so that's just how I've always been, and I prefer nights. But it's been really awesome to be like an RT and to be on my own. It's really crazy. It's really surreal. I go into these moments of like, oh wait, I'm not a student anymore. Like, I'm supposed to do this. Like, people come to me for advice. People ask me questions. People say, well, you're the RT and, really rely on me to be able to do something. And the other day I was the first respiratory therapist to respond to a rapid response. And that was the first time that I've ever been like the only one. And for a millisecond, it pops in your head like, okay, what do I do? And, but like I walked into the room and I like looked at the patient and I was like, oh my gosh, like what do I do? For a second in my head, I was like, not freaking out, but a little bit, I guess you could say. And I looked at the nurse and I was like, what's happening? And they were just like, they're satting low. And I was like, is there a non-rebreather? And the nurse asked me, what's a non-rebreather? And so this patient thankfully was on a Venturi mask. So I just took out the ports and put in one with more FiO2. I believe the highest it goes is 50%. So I put in the 50%. And then by the time I did that, another RT came into the room and I told them I was gonna go get a non-rebreather. And that's what I did. And eventually we got this patient's SATs up. The doctor came, like all the rapid response team came by the time I came back, and the patient was fine. But it's just crazy that, there are instances where it's up to you to do something. The other day I had a patient that I've had for weeks on a ventilator and I was able to extubate her. I did a blood gas and the results came back good and I got to extubate her and she was super happy and her family was happy. And there's just moments like that are so rewarding. And it's just, I don't know, it's really cool to be a part of that and to not just be a student being a part of that, but to actually be the RT and to kind of, just do something really good for somebody. Because I feel like you go through moments of where you can see how respiratory is a little repetitive. Like if you have the floors, you're constantly giving breathing treatments, and sometimes it's to patients who don't need a breathing treatment. And in those moments, you kind of just feel like you're doing billing for the hospital. Like you're just giving this treatment because a doctor ordered it for absolutely no reason to charge them to make money. And stuff like that sucks. But, that's why I educate my patients on what a breathing treatment is. I educate myself on what that patient's history is, why they're in the hospital, do they need this breathing treatment? I talk to the nurse and, you give your recommendations. And talking to your nurse is just so important to have a good relationship with them, because your guys's positions really go hand in hand with patient care. But yeah, so I don't know. This video is just a big old ramble on me being a new hire and me doing both days and night shifts and what I think of each and how it's been for me as an RT. But yeah, thanks for watching and follow me on Instagram because that's where I have everything from quizzes, advice, behind the scenes, and more interaction with you guys. So thanks, bye.